Another thing, the actual prescribing of drugs is a dangerous stage in healthcare, and when it's studied, I mean, there's the ordering stage, there's the transcribing stage, there's the prescription filling stage by pharmacists, there's the administration stage. If you're in the hospital, that's usually by nurses. If you're at home, you do it or somebody does it with you. What's the biggest source of the error? Actually, it's in the ordering stage. The doctors, from the get-go, they will prescribe the wrong drug, maybe because it's not indicated, or maybe just because it's been prescribed in the past, or because it's interactive with some other drug that you're taking now, or maybe the patient has a new condition, such as diabetes or something like that, so he or she shouldn't take the drug, what have you, but more than 50% of the errors are in the ordering stage. Okay, so we've developed something, most good hospitals have something called CPOE, Computerized Physician Order Entry. Okay, that's really good. It does show you, it'll point out an overdose, it'll point out a drug interaction, it'll do some very good things. It's not enough. The best thing that a hospital can have in this area, and patients should ask for it, though it's expensive, is something called clinical pharmacy or decentralized pharmacy. That means a specialized pharmacist actually rounds with the doctors and nurses at bedside and keeps and is there for the initial drug ordering. Pharmacists know there are 10,000 prescription drugs that are active in the United States at this time, more than that, but more than 10,000. Physicians can't keep up with it. They can't keep up with, I mean, they're exploding. They're coming out all the time. And we know, and they're being studied all the time, or they should be. And the physicians only have a glancing knowledge of them, honestly. The pharmacists know about them. And the pharmacist will look at a person, perhaps elderly, and say, well, that dosage might work for a middle-aged person or for a young adult. But that won't work for an older person or a child, a baby. We have to do something else. Maybe cut it. That's a whole very important area. So when they study, the largest study was about 500,000 people, where they studied groups that had clinical pharmacy and a group that did not. Medication errors went down 45% in the group that had clinical pharmacy. It went down 94% in terms of deaths and serious injuries. I mean, it was a big reform in the early 20th century to have nurses make rounds with the doctors, because the nurses were on the floor with the patients. They actually knew the patients. They actually were treating the patients. They knew about whether the patient was sleeping, whether the patient was voiding, whatever. Very, very important. Now we need to have pharmacists included in these rounds. Very important, because once you get the wrong drug on board, it's very difficult to stop it. And the drugs can be very destructive. The side effects can be enormous, as we all know from watching TV. So I would say that, again, it's this teamwork. where, yeah, doctors are generally smart, they're generally dedicated, but they should be, but they're not universal geniuses about all aspects of healthcare. They should be part of teams, and they should be subjected to information controls. In other words, information should flow in a rational way. There's a really important concept in medicine called the handoff. You're in a hospital. You're dealing, or your parent is, or your loved one is, and you're dealing with different shifts, particularly of residents. Okay, the day shift resident said, well, we're going to cut back on the on this heart medication now because the heart rate has gone down dangerously low, and that has various risk factors associated with it. Next resident comes on, he's still using the medication, and why is that? Well, that's because they haven't had an effective handoff. And it's a very dangerous time, this handoff period, this shift change period. And it's been studied quite a lot because there are a lot of errors that are made. And the most prestigious journal in the medical profession in this country is called the New England Journal of Medicine. It studied in 2014 something called structured handoffs in 9 hospitals in New England and Canada for kids, for pediatric patients, over 10,000 of them. And if you give residents a structured handoff protocol where they actually hit like a punch list about the patients in terms of the patient's status, medical actions that are being taken, and most important, crisis planning. What is the thing that can go wrong, and how do we have everybody on the team prepared for it? They found that medical errors went down 30%. Very, very important. And another place where it's very important is in the emergency department or emergency room. A recent study showed that an emergency department doctor in a 30-year career will send 44 patients home to die within 7 days of going home. Those people should have been admitted and treated. Well, the big problem, there are a number of problems, but one of the problems is when you go in an emergency room, you're on somewhat of an assembly line. You go from maybe the nurse practitioner who takes your vitals to somebody else who may do some tests on you, to somebody else, to the doctor, maybe a specialist comes in. But in any event, if the information is lost or is mangled in any way during those steps, you're at greater risk. So we need these handoff controls at all stages in the system. Now, another thing that happens sometimes in the emergency department, and this is especially true with people who are showing stroke symptoms, is maybe we don't in time give the most expensive test. Maybe that test is an MRI, for example. And then the stroke victim is sent home. He or she is told, well, you're a little dizzy. Let's see if it passes. Maybe he has a worse stroke. Maybe he dies. Usually that doesn't happen, but for example, in what are called dizzy strokes, most of the time it's not a stroke. The person is just dizzy for a lot of different reasons that we don't need to go into them. But about 9% of the time they're misdiagnosed. The person gets sent home with a stroke. Very dangerous. And so it's really important to have good diagnosis early, to have information flow rationally, to have good handoff controls, and have teamwork.